Well, good afternoon, everyone, and welcome to today's COVID-19 update briefing. 3 weeks ago, August 19th, stricter mitigations took effect in the Metro East region. And after 2 weeks of exceedingly high positivity rates, that region joined Region 7, Will and Kankakee counties, in operating under even stricter mitigations. While unfortunately Region 4, home to the Metro East, continues to see high rates of community spread with a 7-day rolling average of 10.1%, we've been pleased to see the beginning of a downward trend in Region 7. That's Will and Kankakee counties, and they have reduced their positivity rates with a current 7-day rolling average of 7.5%. As I've outlined, the region would face a 14-day minimum under those mitigations. If the positivity rate averaged equal to or less than a 6.5% average at that time, the region would return to Phase 4 mitigations under the Restore Illinois plan. At this time, the Region 7 positivity average falls between 6.5 and 8%, the window in which IDPH will continue to monitor the area. Assuming things continue in the right direction, Region 7 will stay put in its current mitigation status until the average falls below 6.5%. I'm hopeful that Region 7 might become a testament to the community's ability to turn this ship around in the right direction. If they keep up the good work, Region 7 will soon be restored to Phase 4 mitigations, which would mean higher indoor capacity limits for gatherings and businesses like restaurants and bars. Last week, I highlighted the trend over the previous 2 weeks that 9 of our 11 regions had seen increases in positivity rates. Well, I'm pleased to say that over the last 7 days, most of our regions have seen a slight decrease in their positivity rates, with only 3 seeing a statistically significant increase. Some have asked why action is required when positivity rates balloon to 8% or more. The answer is clear and straightforward. Dr. Anthony Fauci said it best. There will always be cases, he said, but how you prevent those blips of cases from becoming something that obviates the whole program, that's what you're preparing for. You can either close the bars or close the schools. We can't outrun this virus. It hasn't gone away. We can't pretend that we can fully restore our economic vitality as long as it's here without any way to temper or prevent it. Unless we get it under control either by people following the doctor's recommended mitigations or with an effective treatment or a vaccine, we will be fighting to save the Titanic with a plastic bucket. Because there's no national strategy, it's up to us, every individual and every city and every business in Illinois, to slow the rate of infection across this state. Wear a mask, watch your distance, don't exceed capacity limits, be kind to one another. We continue to closely monitor every region, so I want to emphasize again that local elected officials and health officials should pay close attention to the data for their communities and, where necessary, step up and impose greater mitigations on a targeted basis to bring down the number of rising infections and positivity rates. That includes officials at higher education institutions. We're carefully watching the outbreaks that we've seen on college campuses the last 2 weeks. Since our last update, I've attended 2 memorial services, one in our capital city of Springfield and the other in Chicago, to honor the more than 8,400 individuals that Illinois has lost to the COVID-19 pandemic. And while each was a beautiful interfaith service, allowing us a moment to breathe and to grieve and to heal, each memorial also serves as a painful reminder of why we all need to do everything possible to prevent the spread of this terrible virus. Illinois, You already know what it takes. Mask up, keep your distance, wash your hands, stay home if you're sick, get tested when you need. But I'll add one more thing that you can do to help out your loved ones, and that's get your flu shot. It's available in most places right now. It's not too early. In fact, now is the time to do it. And as we continue to battle the COVID-19 pandemic, getting your flu shot has never been more important. Before I turn over the podium, I want to remind everyone to fill out the 2020 census, the survey that determines how much funding Illinois gets from the federal government for schools and hospitals and roads and childcare and much more, as well as what our representation in Washington will look like. Just a 1% undercount could result in the state losing over $195 million in federal funds each year at a time when we need our full funding the most. Just like voting, getting counted in the census is an act of civic engagement, a demand to be fully heard and fully counted. So pick up your phone and go to my2020census.gov. my2020census.gov, or call 1-844-330-2020, 1-844-330-2020. Take the time to make sure that your voice is heard.